Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
This year, 65,000 people in the United States will develop head and neck cancer, which is a group of cancers in the mouth, sinuses, nose, and throat. Worldwide, it is the sixth most common cancer. Some types of head and neck cancers are increasing in incidence, and researchers at the University of Kansas Cancer Center are uncovering insights about the biology of head and neck cancer so that more effective targeted therapies may be developed. Hi, I'm Dr. Roy Jensen, director of the KU Cancer Center, and with me this morning is Dr. Sufi Thomas.
Hello, everyone.
Who is a scientist specializing in head and neck cancer translational research. Also joining us via Skype is Carl Fries, an oral cancer survivor and member of the Cancer Center's Patient Research Advocacy Program, Pivot. In addition, Megan Peters is joining us this morning, who will be taking your questions. First, I want to start off with Dr. Thomas, and good morning. Could you tell us what are cancers of the head and neck, and what are the causes of these tumors?
Good morning, Roy and everybody. Thank you for having these conversations. So cancers that arise in the wet mucosal surfaces of the head and neck, the oral cavity, the nose, the throat, pretty much from here to there, are collectively called as head and neck cancers. The most common type are squamous cell carcinoma, and they are found in more than 90% of patients with head and neck cancers. These tumors primarily are caused by tobacco and alcohol abuse, but more recently, the incidence of human papilloma virus infection has also been associated with head and neck cancer.
So what led you to focus your research efforts on these group of cancers?
Yeah, I have a long history with this. So I grew up in India, and most of my education happened in Mumbai. I completed my PhD from one of the largest cancer centers in Mumbai, the Tata Memorial Hospital. And through my PhD, working on head and neck cancers, I got the opportunity to walk through the hospitals, and I encountered a lot of cancer patients with this particular disease. The reason is tobacco is widely used especially in rural India, because of its ability to suppress hunger. And so the incidence of oral cancers is very, very high. And I got to see firsthand the devastating effects of this disease on the population there. I saw, tremendous morbidity with people living with half their jaw missing, their tongue missing, their ability to communicate with the world and be known as, just the way they grew up, being completely changed because of this disease. That's what caused me to develop a passion to impact this particular community. And so when I looked for a postdoctoral position, I was very happy to join Dr. Jennifer Grandis, who is an MD working in the area in Pittsburgh at that time, in Pennsylvania. And so I continued in this area and kind of cultivated my passion for developing a therapeutic that would impact head and neck cancer patients.
Mm-hmm. So, Carl, and we're delighted that you could join us this morning. Could you tell us about your cancer experience?
Yeah, when I was in my last year of veterinary school, I discovered a white spot in my tongue, which I had oral sores before, canker sores, that sort of thing. And this was just a little bit different because it was on my tongue and it was a white spot. And so I went to an oral surgeon and we biopsied it, and it was epithelial dysplasia, which means just not normal cells, but not into cancer. So I was told to just watch it, and I did. seeing either an oral surgeon or a head and neck or ear, nose, and throat physician every year for about 14 years. I'd had an additional biopsy, and it had not gone any further than the dysplasia. But in July of 2011, just a couple months after my last surveillance checkup, I felt something strange in the back of my throat, kind of like I had a popcorn kernel caught there. And it was a sensation I had not had before, and it wouldn't go away. And so I went back, and initially was told maybe it wasn't anything to worry about. And so I sought other care. And this is one of my things to tell people: if you have to be your own advocate, if something doesn't feel right, just keep digging, keep investigating. I went to a different physician and performed a biopsy and found out I had squamous cell carcinoma of the tongue. And so that fall of 2011, I had surgery at KU, and we felt like the cancer had been removed. And at a following checkup in February of 2012, there was a recurrence. And so I went through yet another surgery where a portion of my tongue was removed, an additional portion. At the first surgery, part of my tongue was removed, as well as a number of lymph nodes from my neck to stage the cancer and see if it had spread, which it had not at that time. So I had the recurrence. I had a second surgery, ended up having several teeth and part of my jaw removed, as well as going through radiation follow-up, 30 treatments. And that ended in June of 2012. So I'm now eight and a half years out of treatment. And I like to say Dr. Thomas, talked about some of the things that can predispose to oral cancers. But in my case, I like to joke, because you got to keep a sense of humor, that I won the cancer lottery because I was not a smoker, never used tobacco, only social drink. As a surgeon for horses, with my emergency call schedule, I might have 2 drinks a month. And so I didn't, and my cancers were not associated with HPV or the human papillomavirus. So I literally say it came out of nowhere, but I had to deal with it. And fortunately, with the help of the teams at KU, I'm here to be talking about my experience.
So glad that you're here with us today, telling us about this story, and so glad that things have turned out well for you. So obviously, this experience led to your involvement with our patient advocacy program called Pivot. Could you tell us a little bit about Pivot and how you've been involved with that organization?
Yeah, I would love to. Pivot is such a great organization because it takes cancer patients, cancer survivors, and their caregivers, which might be family members, it might be friends, whoever it is that's helping you through your cancer journey is your caregiver. It's taking these people and pairing them up with researchers in order to basically get unique and individual perspectives on the cancer journey from each patient, each caregiver, each survivor, so that information can be put into helping the general population that's dealing with head and neck cancer. It puts a personal touch on their research, but importantly, what it does is it helps them to focus their research. So we get into teams called rapid reactor teams. We listen to researchers propose clinical trials or studies that they're looking to get funding for, or they're looking to just develop, and they've got the rocket science end of it, and we've got the personal experience, so we can say, look, there's more to it than just the nuts and bolts of treatment. There's so many things on the side that have to be involved in these decision-making processes so that when research goes forward, it's the most efficient possible. And I think it's amazing what this group does in order to help guide, in our own way, guide research, but we get so much back in the process. My wife, Laura, was my caregiver and continues to be so, and she's involved in the program as well. And that's just an example of how Pivot involves everyone, not just the patient. And that's important because there's so much to the cancer journey that we know. I mean, we know the science end of it. It may not be clear to everybody because we come from different backgrounds. That was one thing about my personal experiences as a surgeon. I felt like I could ask the right questions as far as many of the treatments, but going through the process, I learned very quickly that there's so many little details, well, some large, some small, that go into each one's journey that just goes beyond what currently is presented in the exam room. So that's what, as a member of Pivot and Pivot as a whole, is trying to do is bring the voice of the patient and the caregiver and the survivor to the process of developing cancer therapies.
Well, thank you so much for sharing that story. That's really, fantastic, and we deeply appreciate your involvement in Pivot. If you're just joining us, we're here with scientist Dr. Sufi Thomas and patient research advocate Carl Fries, talking about her head and neck cancer research and Dr. Fries' experience with his own head and neck cancer. In addition, Megan Peters, who is joining us via Skype, can take your questions, and please remember to share this link with people you think might benefit from our discussion. Use the hashtag #BenchToBedside. So, Dr. Thomas, you study a specific aspect of head and neck cancer biology, which is the tumor microenvironment. Tell us about your work and why is it so important to understand this particular component of cancer?
Yeah. So for many years, I primarily focused on studying the squamous cell carcinoma biology in order to develop targets for therapy. And as these findings moved into clinical trials, what I found was that we didn't get the types of responses in patients as we did when we were studying the tumor in our petri dishes in the laboratory and in mice models in the laboratory. So we didn't get the same response rates that we did in our lab that when we went into the clinic. That got me thinking and very interested in the differences between the tumor existing in the patient versus in our laboratory systems. That is why I started looking at the tumor environment or the microenvironment that the tumor exists in. So if you think about a normal tissue, it's much like that bed behind Carl that you see with the sheets very neatly tucked in and the pillows placed very nicely, well organized on bed. When you have a tumor growing within that system, what happens is the blankets get pulled off and the pillows get ruffled and the environment gets adjusted so that the tumor now is very warm and snug and comfortable and thriving within that environment. So this interaction not only helps the tumor to grow, but also affects how it responds to the therapies that we administer. What we found in my laboratory is that cells called fibroblasts or cancer-associated fibroblasts facilitate tumor growth by providing nutrients and growth factors to the tumor, but also affect the way the tumor responds to therapy and protects the tumor from therapy. So it is very important, we found, to understand this interaction to block that communication between the tumor and its surrounding cell types that are non-cancerous. And so that you isolate the tumor and allow the cytotoxic therapy to affect the tumor and get rid of it. So this is what we've been primarily studying, and that is why the tumor microenvironment is extremely important to understand in order to improve our therapeutic efficacy.
Mm-hmm. So obviously one of the most important things that we can transmit information-wise on this program is how to prevent cancer. And what are some of the ways that an individual may reduce their risk of developing head and neck cancer? And I'll start with you, Dr. Thomas.
Yes. So like Carl mentioned, a lot of times there could be genetic factors or other environment factors that we're not aware of that could cause disease. So routine screening is very important. Good dental oral hygiene, extremely important. But the easiest way to stop head and neck cancer for many individuals is to just stop smoking, reduce alcohol consumption, and maintain lifestyle choices that affect or reduce HPV, or human papillomavirus exposure. We now have a vaccine that's available to HPV. Those individuals that are HPV negative would definitely benefit, especially children, from getting the HPV vaccine. And another aspect that I really want to highlight is the use of e-cigarettes or vaping. There was a recent study demonstrating that vaping can affect the oral microbiome. These are the bacteria and other microbes in the oral cavity. It is important to understand that changes in the normal oral microbiome can increase inflammation in the tissue that could then facilitate tumor progression or cause of cancer. So avoiding e-cigarettes, tobacco, alcohol, maintaining healthy lifestyle, and taking the HPV vaccine could all facilitate health and prevent this disease.
Carl, is there anything you'd like to add?
Well, I just want to echo what Dr. Thomas is saying and point out that how important her work is, and the other researchers at KU, how important it is, because head and neck cancer can be devastating. I mean, just the deformity, the destruction of the tissues from the cancer itself. But, let's be real, the treatment to address it can be devastating as well. When a part or a hole of your tongue has to be removed, or part of your palate, the roof of your mouth, if teeth, if bone of your jaw have to be removed in order to remove the cancer, that affect, think what that affects, your ability to speak, your ability to swallow. Two things that are so important to our social fabric, communicating with those around us, sharing a meal. That's why head and neck cancer can be so overwhelming. And again, not just the cancer, but the treatment. So when researchers like Dr. Thomas find ways to treat cancer, but in the least invasive way possible, that benefits all of us. And certainly we want to find a cure, but I'm so happy that there are folks like Dr. Thomas working on treatments that will mitigate the secondary effects that come from the needed treatment.
Excellent. So, Megan, it looks like we have a question.
We do, and this question speaks to what you all were just talking about. The question is there a genetic risk factor with head and neck cancers? And if you have a family history of this type of cancer, how should you approach this with your doctor?
So there are a lot of mutations that are associated with head and neck cancer, but a genetic predisposition has not been clearly outlined yet. So there are no genetic tests that can definitively say that you are predisposed to head and neck cancer. However, like I mentioned earlier, routine screenings would be very essential. So, dental checkups and examinations during that time really would facilitate and identify early lesions, especially white patches like leukoplakia that Carl was talking about, tracking those and making sure there are no changes, extremely important.
Mm-hmm. Yeah, I think that the role that dentists play in screening for head and neck cancer is an extremely important one, and yet another reason to engage in good dental hygiene, including regular checkups. Looks like we have another question, Megan.
We do. The question is, who is eligible to receive the HPV vaccination?
As far as I know, anybody that is HPV negative would benefit from the vaccination. Children as young as 12 to 13 years of age can begin taking the vaccination. They get booster doses. I know my son is 14 and he's already gone through the vaccination schedule.
So the recommendations in regards to who should receive the vaccine have shifted a little bit over the years as we gain more information. Right now, I believe that the vaccines are approved for folks up to age 26, and we will post the exact information on our website to make sure that you have that. And that's, of course, both for men and women. the reason why there is such an emphasis on trying to get vaccinated before the age of 12 is that our immune systems are much better at that stage of life, and you get a very robust response to the vaccine. And you don't have to take my word for that. You can take COVID's word. If you look at the impact of COVID on children, it's much, much less, and the thinking is that that's primarily due to the fact that young immune systems really do a much better job than those in older individuals. However, I would suggest that folks keep a close eye on the recommendations, because, as I've said, they change over time as we continue to gather more information. And in fact, if you have not reached the age of 26, but say a pap smear is positive for HPV, the recommendation is actually to continue to get the vaccine, because it is actually against 9 different types of human papillomavirus. And so the thinking is that a vaccine may be able to protect you against even the types that you have not yet been infected with. So sounds like we have another question, Megan?
We do. What are the risks of getting oral cancer between smoking and chewing tobacco?
It significantly increases the risk, and a good illustration of that is Carl, in that, Carl's a bit of a unicorn. There is no reason to believe that he would have been at risk for this disease whatsoever, and so it's extremely rare in individuals who do not drink and do not smoke. And the last few years, probably the last 15 to 20 years, what we've seen is that there's been a huge shift in the causation of this disease with the rise of HPV-associated head and neck cancer malignancy. And that is it's really a completely different disease than head and neck cancer caused by tobacco and alcohol. It behaves different clinically. It responds to treatments differently. And of course, in this case, it is also can be nearly completely prevented by the vaccine. So it's a different type of cancer, and needs to be recognized as such. All right. So we are close to the end of today's episode, and Carl, I want to give you another chance to weigh in here. What advice would you like to give patients who may be facing a head and neck cancer diagnosis?
I think the most important thing I can say is to know that you're not alone. Your own cancer journey is going to be, sadly, very unique and very personal, but there are other people, so many out there, who have gone through it that are willing to help you. There were folks that helped me that had been through it. I've helped other people. There's, the group at Pivot. There's so many resources through the KU Cancer Center and other groups, Midwest Cancer Alliance and so forth, that are there, and resources online, printed resources. And that's what we're doing with Pivot, is trying to make those resources more readily available. But I do want to say that there are people out there that can help you through it, and your physicians are going to do a great job of handling the treatment, and then other patients, other survivors, other caregivers can help you with dealing with all the sideline surprises of cancer that go along with the whole experience.
Well, Carl, that's great advice. I want to thank you and Dr. Thomas for being part of this week's episode of Bench to Bedside. I think we put out a lot of good information today. To learn more about head and neck cancer, please visit our website, kucancercenter.org/head and neck cancer. That's it for today. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching.